Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
Good afternoon to all our radio listeners and viewers via Facebook. Welcome to another segment of Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and today we're talking about managing your diabetes. And to tell us more about that is Dr. Davina Ramsing, a General Medical Officer for the Diabetes at the Chronic Diseases Unit at the Ministry of Health. She will be talking to us ahead of World Diabetes Day, which is observed on November 14th every year. Welcome to the program, Dr. Ramsing. And before we go into our discussion, we usually share a bit about what we're talking about. So I did some research, and internationally, international sources, health sources, talk about diabetes, how many persons are affected, and about 500 million persons are dealing with this disease right now. Worldwide, and the majority of them live in low and middle income countries. 1.5 million of those persons die from the disease every year. Both the number of cases and the prevalence of the disease are steadily increasing over the past decades. But when we look at the history of the disease, it shows that diabetes was only medically registered as a condition in the 1400s. And based on the research, Asian, Chinese, and Indians would test for the illness using the level of sugar evident in the urine, or those based on the stickiness or the appearance of that urine, and they would use ants to go to see how the ants if the ants is attracted to the urine to see whether the person has diabetes. Today, there are a lot of tests and other technology developed to test for diabetes and to treat it. So in your own words, tell us today, what is diabetes and how a person diagnosed with that disease, what should they expect?
So first of all, I want to say good afternoon to everyone and our viewers on the Facebook and our listeners as well. And I want to say thank you, Ms. Ramsey, for reaching out to me, coming to do this talk. And it's one of the most important area that we as gynaes need to be aware of. And like you said, on the 14th of November every year, it's World Diabetes Day. As much as set aside as one day, we like at the Ministry of Health to mention it as a month celebration or awareness month. You know, because it doesn't take one day for us to conquer or to put awareness to everyone. So thanks again for having me here. To go to your question, what is diabetes? Now, as we all know, diabetes is a chronic disease. It is a disease that has no cure, and it's a disease that we cannot reverse. All right, but it is the way it affects our food to be converted into energy. And when I say that, it might sound a lot of terms there for everybody to understand. But what I'm saying is that foods that we eat are digested or broken down into glucose, as we know as sugars. And these sugars are being passed into the bloodstream. Now the body produces, or the body relies on a hormone called insulin that is produced by the pancreas, and that helps the glucose or the sugars to pass from the bloodstream into the cells where you can use up this energy. Now, there are different types of diabetes, and I'm just going to mention the two major types that we have. We have type 1 type 2, and we have gestational diabetes. We also have something that's called pre-diabetics or pre-diabetes. So now for the type 1 diabetes. Type 1 is where it is being, at any age you can have this diabetes, but it's more prevalent in children or in young adults. And it's where there is no insulin supply, or you're not producing any sort of insulin. All right. And in type 2, it is more found in adults, possibly in ages greater than more than 45 years old. And it comes from your lifestyle or obesity, different factors that causes this, environmental factors that affect you.
So the first one is mostly inherited, hereditary.
Right. Inherited, you can born with it. Right? And the type 2 is the ones that would occur onwards as you in older ages. All right. Gestational diabetes is the one that you get during pregnancy. Right? That's meaning the mother was not diabetic before. Right? It happened during her pregnancy. And that can affect the child as well. All right? And you have pre-diabetics or pre-diabetes. This is where you have persons who are having high blood sugars that are higher than normal, but it's not high enough to diagnose you to become diabetic. But it's a higher risk for you to become diabetic onward as you without not being controlled. Right? I'm not sure if I'm clearing it up there.
Yes, I understand. I'm sure many of the persons listening would have some form of clarity in terms of what you're saying. In terms of risk factors, can you speak to the risk factors? We know hereditary, inherited genetics is one, but what are some of the other risk factors?
All right. So there are many others, and as you said, genetics or family history are one of those causes. We also have if persons are obese or just gaining weight. All right. You have persons who are inactive or have a sedentary lifestyle, meaning not doing much.
Yes.
All right. And we have persons who are like I said, pre-diabetics. All right. So those are persons who are at risk of having this disease.
And this is because of
uncontrolled sugars or your health, your lifestyle or environmental factors, like I said before, can affect can affect your risk factors.
I touched a bit on the origin of it being medically registered and since the 1400s. But what today, I don't know if they would have, technology would have helped you to get to the root cause of diabetes.
So the root cause of diabetes, like I said earlier, is with your risk factors. It has to do with family history. It has to do way of life. All right. It has to do about all environmental factors that are affecting us.
In terms of environment, what do you mean by that?
So let's go down where it comes down to where persons are not eating as healthy as they should, and I should not say diet because that's not the term we use anymore. Diet is more of people thinking starvation, staying away. But when I say environmental factors, I'm meaning those things like eating healthy and a balanced diet and an appropriate healthy eating lifestyle. Having to do with exercising, having to do with what you eat on a daily basis. All right. How much you eat. If you're doing portioning of food, how much food are you eating in a day? How many carbohydrates are you taking? How many fruits are you taking? How many proteins are you taking? Those sort of things that we are looking at environmental factors. As we all know, most people turn to a lot of packaged stuff, tin stuff that we have on the supermarket. Not saying that those things are totally should not be used, but we should limit the amount of preserved food that we use now than going back to the gardening stuff. Our fresh fruits and vegetables are the most important things that we should eat now.
And in terms of food, oily food, how impactful is consuming? And we know in Guyana, in the Caribbean, other parts of the Caribbean, we use a lot of spicy food, oily, not necessarily oily food, but the kind of food that we use, we cook would use a lot of oil or fat. What types of foods, or how do you recommend we cook in terms of keeping our foods healthy enough for consumption when you have this kind of condition that you're dealing with?
All right. Like you said, Guyanese is about, we Guyanese have a lot of different backgrounds. We like different tastes in our food, and like most people when they visit, they always enjoy it. That's one of our cuisines that we have here, our food. And I must say that preparation wise is that we have learned that if you speak with a nutritionist, they will tell you that we normally overcook our vegetables. You know, you're supposed to have them steamed. And when you're using the word oil, like you wanted to mention how much oil do you use, or
Yes. Level.
They say that you use your thumb to measure the amount of oil that you're using. All right, and that's the amount you should put into your pot that you're going to cook. Or like they normally say, when you put the oil in, it just should cover the surface of your pot at the bottom. So that when you're steaming your vegetable or cooking the vegetable, that's the amount of oil you're using. So that you don't have to see when the food is finished, you see the oil floating at the top. We don't want that, right? And we're advising that you avoid using a lot of fried foods. You know, we like to consume a lot of, I know when persons making eggs and all of that, they like to deep fry their eggs. We're trying to advise you not to do that. Right? That is not one of the ways that we want you to start continuing, because it affects your cholesterol. Having uncontrolled cholesterol is also a very key area in your diabetes control. All right.
So they go hand in hand, basically.
Right.
As you're touching on other medical conditions, what are some? We know that there's some other medical issues that being diabetic, and if you're not controlling properly, it could trigger other medical conditions. Can you touch on some of those?
So having diabetes is they say it's a silent killer. And as we all say in the medical field, or when you go to your doctor in wherever you go, either private, in the private health care centers, they always tell you that diabetes affect every organ. All right, and we have short-term complications, and we have long-term complications. Now, your short-term complications are things like when you get hypoglycemic, when your blood sugars are very low. You could get hyperglycemia when your sugar levels are very high, and you have something we call ketoacidosis. All right, so that there is all your short-term complications. All right. Now, for long-term effect, these are the areas where it affects your organs and all that. Slowly and gradually, it takes years for these things to start showing up. It does not happen overnight. All right. And some of the long-term effect that you would have, you normally hear about retinopathy, where people become blindness to the eyes. You would have neuropathy, damage to the nerves in your feet, starting from your feet, where patients would complain about, or individuals living with diabetes would complain about numbness, having a sticky sensation in their feet, or unable to feel anything when they touch a ground. They don't know if the surface is hard or it's soft.
Wow.
Those are the symptoms you will get from neuropathy.
And those are long-term?
And those are long-term effects. All right. Some other effects you would have is a nephropathy, where you have damaged kidney. All right, and that's the end stage of diabetes. All right, and you also have persons who will suffer from cardiovascular diseases, heart issues, hypertension. Once you're diabetic, you at some point in time, being diabetic, you are going to become hypertensive. All right, so all those areas you have to take control over, and it takes time. Like I said, it takes years for those things to show up, right? So it's better to get diagnosed early. It's better to get screened early, even if you don't think you're having symptoms or have any of the risk factors that I've mentioned before, having family history, or you don't think that you're not eating or you think you're doing everything right, you still need to get yourself screened. All right, just to be on the safe side, that you're not being a pre-diabetic, walking around and not knowing. Because sometimes you will find that most persons are pre-diabetic, and when they become complicated, then is when they actually find out that they've had diabetes. And it's unfortunate that doctors or health professionals and not medical persons to, get back to the stages where they could have captured it earlier. And we need to start taking our health in our hands. It's all the control in ourselves. It's all about us doing the right thing.
And that means prevention. Using preventative methods. And when we speak about preventative methods, we talk about eating correctly. And even if you're not, tell me if you could correct me if I'm going wrong. If we're not showing any signs and symptoms, which is like having any symptoms.
Okay, so your symptoms that I guess you're looking at is that persons would generally look for these symptoms where you have eating a lot, excessive hunger, excessive thirst. You might have itching to the skin. You might find that you have, let's say you have a wound or a sore, it takes long to heal. Those kind of things you look for. But however, every individual is different. And you would never find that everyone have the same symptoms, or you would have all of the symptoms that are there for diagnosing a diabetic. But we're asking that if you've noticed any 2 or 3 symptoms that you think it's bothering you, you find that you're in a cool place and you're just sweating profusely, you're getting up in the night and you're just urinating a lot, you find that you're becoming dehydrated, or feeling thirsty, your lips becoming dry, start taking a check of yourself. You don't have to wait, they said you wait for more signs. Doesn't work like that. Everybody is different. Everybody's bodies react differently, and the sooner it's better.
And in terms of testing for diabetes, I know the Asian thing was the urine. Is it the same way today?
No. So we do test the urine for other areas, but the ones we use now to tell a patient, you just come in, or individual who's coming to get screened, we ask you to do random blood sugar testing. That means right on time. You don't have to fast for that. Whatever time period you've eaten, you've reached to that center, to that healthcare facility, we will test your sugar on spot. Right? We'll have our readings to tell us whether it's high or it's low or it's just above the borderline. Now we have fasting blood sugar, where we ask you to fast for a 12-hour period and get your blood sugar tested, so that we can have what is your fasting sugar looks like. We also have one that's called your HbA1c, I'm sure everybody heard about. And that's a sugar testing done with your hemoglobin to tell you what was your sugar levels within a 2 to 3 months period. So that gives us a longer time to tell that, okay, so your fasting sugars have shown your 140 or 150. Your random sugars shows that you're in a 200, above a 200. And now we have your HbA1c that's telling us that during a 2 to 3 months period, this is what your percentage of your sugar is looking like. If it's above a 7% or 7%, we know that you're trending towards, you're going to become diabetic, or you're diabetic. All right?
I was touching on preventative measures, and we know that diet is you said food is a key thing. One of the things somebody mentioned is that we use a lot of curry, foods made with coconut milk, salt, a lot of sweet, well, not so much sweet, but the fatty foods and so on. Can you, because you touched on it earlier, but can you say whether consuming too much of, or how much of these popular cuisine we can consume to stay safe from diabetes or getting or keeping it under control? How much of it is a safe amount?
So I'm normally what we do in the Ministry of Health, or what we try to advocate to our public, is that we do portioning. Now, like I said before, we don't say diet anymore. I know I might say the word because it's now we're now coming out of the word diet. Now, it's not diet; it's healthy eating or portioning, or having portions in our healthy portioning in our plate. Now, just imagine your plate in front of you, and we're going to put them in 4 quarters, right? Each quarter is going to represent a part of your food group that you should always have, or should at least try to have at the end of a day. All right? So you have a quarter of your proteins. We're going to have quarter of your starches, quarter of grains, and your salad. You know, we want to make our plate looking balanced. Not like what we normally do here, is that we have lots of starch.
Rice.
Right? A lot of rice. And then you barely have vegetables on your plate. Right? And some people like lots of meat. As much as meat is important as well, you have to remember that it has a lot of fat. Right? And digestion for meat takes longer than the vegetables and the fruits. So we try to encourage that you imagine your plate. Now, like I said before, these are habits that is hard to break. Right?
Because
From
of
a
culture.
That we have, it is very, very difficult.
Culture.
And it takes time, and it takes a lot of determination, not just a doctor's determination or a healthcare worker, but the persons living with diabetes. It takes a long time for them to adjust to a healthy lifestyle.
Yes.
Right? So, like I said, you should accomplish this plate in one of your meal. And I'm going to go to meal again. Now, as many patients and many individuals who are living with diabetes would have heard this before, that you eat frequently, right? The advice from nutritionists, the food policy department they all came up that you have to eat, globally you have to eat 6 meals a day, right? When I say 6 meals, I do not mean 6 big portions of meal. Right? We're going to have our breakfast. Then in between breakfast and lunch, we have a snack.
Yeah.
Then we have lunch. Then we're going to have a snack again. Then we have dinner.
And these 6 meals would be that you portion these meals. That is why it's 6 meals.
Right.
So you don't have one
right.
large meal and then because your body cannot process the blood sugar or what it is, the saturate that into your system if it's in large portions. That's what you're saying, basically. Okay.
So, and it's just not the large portioning. It's just that it helps you to monitor your blood glucose level or your blood sugar level throughout the day. Right? Everybody, like I said before, everybody's metabolism is different. It's slow. Some person's metabolism is slower. Some person's metabolism faster. And it gradually takes you into different levels of where your blood sugar levels are. Some people wake up with a high blood glucose level. And let's take, for example, normal countryside person or person who like to eat. You normally hear on the radios and stuff, people start eating rice in the morning for breakfast, or things like pasta, like your chow mein and your macaroni. Those things are not for your breakfast. Imagine you waking up with a 200 sugar, eating this type of food, then you're going to have it back for lunch. Then maybe for dinner you're having rice.
High
right?
starch.
So that's too much starch for digestion to take place. And then imagine what the sugar levels are going to be like the next morning. Because all the day your sugar levels are going up high and higher because of the amount of starchy products you have taken. So that's why we've given you, or we have started, and this is not yesterday we've started the plate portioning. This is about 2 to 3 years or even more. We have started doing plate portioning for persons living with diabetes and even persons generally to the public. That's how you start training yourself to eating. Going back, staying on to meals, I want to encourage a lot of intake of water. Normally when we are working or we're at home or you're living with a disease, or let's say you're diabetic, Many persons tend to tell themselves, oh, I'm feeling thirsty, I need a drink, I need a little energy, and we eat nothing to gain energy, and we turn to a soda. Right? We never think back that we need to intake of water. The only way we are taking out waste from our body is by urinating. And the way to filter all those toxins from our body is by drinking lots of water. So I encourage that at least every meal, persons out there, even if you're not diabetic, start incorporating water as your daily practice. Don't wait until you're thirsty to have a glass of water. All right, recommended amount of water is 2,500 milliliters.
And that
All right.
translates to how many bottles? How many glasses?
The glasses would be like 8 to 10 glasses of water. And mind you, that's a full glass of water, because some person stand in front their dispenser and is like, oh, I take 3 glasses of water, but they're all halfway filled. So ensure that you fill. Get one of your tropical mist bottle, right? Those 1 liter bottle. You fill it with water, and you don't have to drink it out every single day. It's a starting process. Not all of us like water like that. So it's a gradual process where you start taking little by little every day, and you start accomplishing that bottle. So by the time you're in the evening, you don't have to drink water to be getting up in the night, fatiguing yourself, fatiguing the body. And then when you wake up, oh gosh, I did drink water. How is it that my sugars are high? But that's because you put the body under stress all night, getting up to go urinate every half an hour, every 10 minutes, every 15 minutes. It all depends on that person, the amount of control that they have to go to the washroom.
So it's better to do it in the day.
Yeah,
and
take it as your normal routine as you go by during the day. Oh, I've only accomplished half bottle of water before lunch. Then I can do the next half after.
Yes. All right, that's quite a bit. We have some persons, and if you wish to ask a question, Dr. Ramsing would be willing to answer. We are Facebook Live. You can post your questions, and we'll be happy to answer it. Let's go to a short break, and when we come back, we'll hear more from Dr. Ramsing on managing your diabetes.
Getting vaccinated is important in protecting yourself and those around you. The COVID-19 vaccine is not a cure. The Ministry of Health's vaccination drive is to remove the virus's ability to cause hospitalization. It helps to look at your exposure to COVID-19 like this. Best case scenario, you don't get infected. And the worst case scenario is death. Get vaccinated today. This is a message from Guyana's Ministry of Health in collaboration with PAHO WHO.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burbies 99.5 FM. Kaieteur Radio.
Welcome back to Your Health Matters here on Kaieteur Radio. I'm your host, Rihanna Ramsey, and we're talking to Dr. Ramsing, Dr. Ramsing from the Ministry of Health's Chronic Disease Unit, and she is telling us about managing our diabetes ahead of World Diabetes Day, which is observed on November 14th. Dr. Ramsing, we were talking about diet, and we're still on that subtopic. And one of the things that came to my attention is fruits and vegetables. You talk about eating portions, which is good. We should all try to eat portions, but in terms of fruits have a lot of natural sugar. And what would you say? Would you recommend use of fruits, things like natural that would have natural sweetness, like honey, and natural fruits? What would you say to using those those.
All right. So as we are on diet still, and we're still talking about helping us with our portion, fruit is an excellent choice of your portioning, or to be part of your daily routine, because as you said, fruits have natural sugars, which are your fructose, your sucrose, and your glucose, right? These are natural sugars that you get from your fruits. That means all fruits, right? Not some fruits and they're only certain types of fruit. All fruits should be eaten, right? However, we're recommending that we do not make a salad for fruits, or a bowl of fruits, right? We're just going to take one fruit a day, right? That's one fruit a day. So let's talk about banana. Many of us either like our cayenne banana, they're very big. So they advise that you have, if you're planning to have your second snack in the afternoon, you have half a banana now and half a banana later. It's like saving your fruit for the next day. That's what we're teaching you. So we don't want persons to go out there say, oh, the doctor said fruit is important and any fruit is important, we need to eat all of it. That's not what we're advising. We're advising that you eat fruits, but you incorporate it one fruit a day. All right, I know some persons, they would like their mangoes, and when there's a season of mangoes, they go buy, and how much they buy for $200, they sit one time and eat it out because, oh, it tastes really good.
No.
That's not what we advise, or that's for lunch. I'm going to have mangoes for lunch. We're not advising that. We're having one fruit a day, and that is enough for us for our daily consumption of fruit.
In terms of honey, I'm told honey has a lot of healing properties. I don't know, because that's a natural sweetness. Is that recommended when you're dealing with diabetes?
So it is a substitute, yes, but at the same time, honey has a lot of sugars. That is, as we have not in Guyana have not tested that or have any studies of it. But we found that when patients substitute sugars for honey, like I said, little is
enough.
Good. Maybe a small tablespoon is enough for a sweetener. But there are persons out there, or generally Guyanese, when we hear about something that is good for you and it could help you, we tend to go overboard. It's every day, 3 times a day, or even 4 times a day. All right, so we advise that if you're using honey, I am not stopping anybody from using what they like, but you have it in consideration. You have it as we go back portion, right? You don't have to have it in your tea or your milk or your porridge, whatever you put honey to. You don't have to have it there.
And another thing, olive oil. We have read, and it's widely publicized, that olive oil, extra virgin, by the way, not just olive oil, extra virgin olive oil. Olive has some kind of natural properties in it that helps with cholesterol and diabetes. What do you say to persons using that, or would you, as a doctor, a medical person,
Advise it.
advise? Yes.
I never, my personal experience, I've never asked patients to have to get things that they read or they've heard about using. And yes, it is true that olive oil has properties that is
Extra virgin.
Right. Extra virgin olive oil has properties that are better than the oils. And why it is so is because of the refinery products that happens, right? And I know having virgin olive oil, it's pretty expensive on the market, right? And it's healthier to make in your salad, to cook your food. All those properties, it's very important, and it's healthier. However, I do not, like I said, every person is different. Every person have their challenges, and every person have their likeness. So as a medical professional, I do not advise that you have to get something because this is the only way it's going to help you. We're living in a country that we have a variety of oils. We have persons living in different areas that can't have access to these products. So what I ask is that whatever oil you're using, that you use them with limited amount. And like I mentioned back, you use your thumb to measure the amount of oil you're using. All right, that's the amount of oil we should be using when we're cooking our food.
We touched on food and all of that. We also, you said exercise. There's some basic exercise that you can do. And there's also the use of insulin and other medication. Could you touch a bit on when insulin is important, when insulin can be used? Because not every person that has diabetes can use insulin. So when is this recommended?
All right, so we're going back to the types. So like I said, type 1 is about where you're born with it. It's genetically, you genetically get type 1, where your body has no insulin at all. So persons living with type 1 diabetes are the persons who have to take insulin.
Yes.
Insulin is only recommended to those types of persons, type 1 diabetes. Type 2 diabetes is persons are not recommended to use insulin. They're more given oral medications like metformin, glycoside, Daanil, like we commonly use here. All right, so insulin is only given to type 1 and not to type 2.
Okay. And in terms of the other medications, we know metformin is very popular. I have a little bit of experience with that. But I'm told that some people talk about side effects, about these diabetic medication after a period of time. Is it common that they would develop side effects after using medication, and what type of side effects?
Most naturally, all medications give you side effects, and there's no excuse for diabetic medication. And they all give side effects, but the number one drug that is used for controlling type 2 diabetes is metformin. And maybe before you can ask me, I'll say there is a myth in Guyana that metformin is bad for your kidneys. Now, when I say myth, it's not true, right? That is something that somebody started a rumor and it went wrong and everybody hears about it, or they've known somebody who suffered using metformin. However, that's the number one drug that is given for us to start someone who's diagnosed, or you just diagnose someone with diabetes. We start you on type 2 diabetes, that's per se. We start them on metformin, right? However, the challenge with metformin is that many patients would come back saying that they're having side effects, such as you would have diarrhea, they'd have being nauseous, they'll be having vomiting. Those kind of things you hear patients coming back saying that they've had with metformin, starting on metformin, right? And most times doctors try to reduce the amount of metformin they've started them on, or you try to give them at a longer period of time to using during the day, right? Because it's one of the first line drug that we use to control type 2 diabetes.
Yes.
All right. Now, metformin, however, can have its impact when it comes where a patient might have a kidney damage or a kidney failure, as we would hear. Now, or person living with, I shouldn't say patient, persons living with diabetes or being diagnosed, the first thing a doctor does is they would screen that patient thoroughly. When I say screen, it means we're doing each organ to ensure that all is well. And one of those tests that we do is your kidney function test. Once we find that your kidneys are well, all right, or they're functioning well, patient can start on metformin. Patient goes on metformin. However, if we found that, okay, we're having a problem with your kidney function, your test, we are not advised to start, but you can start, but you have it in a reduced dose.
Yes.
And as physician, what most times we do is refer you to the nephrologist so that they make their recommendation on if to go ahead with metformin and what amount they should stay on and for how long. And those patients are being monitored with their kidney functions to see how they are coping with metformin. Is it that it's damaging the kidney more, or is it that it's working well? But never is it that metformin is damaging your kidney. That's the key point that you have to understand. It's not damaging your kidney.
Okay, so we're moving along and the time is running. We have some scenarios where persons with diabetes could lose their limbs or their toes and stuff like that. And what causes that to happen, and what can we do to prevent it? Can you speak to that aspect?
Amputation is one of the rapid areas that we're having in all regions. And I'm not sure if you have read, but due to the increase of amputation, we have in the ministry have started DFC centers in the 7 regions, and that there is to screen persons who are living with diabetes to have their foot screened so that we can tell how far they're having nerve damages.
Wow.
DFC means diabetic foot center or diabetic foot care center. All right, and there's where screening is done for patients who are living with diabetes or have been diagnosed with diabetes. We screen those 4 persons by doing the 60-second screening, and that tells us how much damage or nerve damages that person is suffering from, so that we decrease the chances of having amputation. Now, persons already have amputations. If it's a toe, if it's a limb, it's due because of the damage to the nerves in their feet and due to injuries occurring and patients not knowing what's going on. And like I said before, we always capture these things very late where we cannot save it. So it ends up that patient will have an amputation. Now, patient having an amputee should always still not give up. I know it's hard to live without a toe. It's hard to live without a toenail. So imagine living without a toe or a limb. It's pretty hard. I can't put myself or imagine how depressed that person is. And most times you find that patient having an amputee is more likely going through a depression stage or a stage where they're already giving up on life. And I want to stress on the point that life it's not going to stop. All right, it still goes on, and you still have to control or manage your diabetes so that it don't affect your other limb or affect the rest of your organ. So the same things that I advocate for: eating right, exercising, get screened, it comes back to all of that. And when I say exercising, I don't mean you need to go to the park and run miles. You sit in a sturdy chair and you do up and down motions. If you can lift your body up, you can do stretches with your legs. We still need circulation in those areas. All right, and circulation doesn't take place in your head, it takes place at the bottom of your feet.
Yes.
All right, so we need you to still move those little toes that you still have there. Move that limb, because eventually it's going to make the muscles become tight. You'll become motionless, and you won't be able to use them as you should. And we all need our foot to take us to places. I know even though it's COVID, a lot of persons are at home and they're not putting their health in front. They are looking at, I can't go see the doctor, I can't go to my appointment because of COVID, I'm scared. But it's not about going to the doctor, it's what you're doing after you come from the doctor. Because most of us have appointment in a month's time, in 2 months' time, whatever it is. So I beg that even though you're at home, use your improvise at home. Get 2 bottles, fill them up with sand or water, and do stretches by lifting it like weights. Do your up and down motions in chairs, stretching out your feet. Small things. You get those bicycle tubes. You cut a little piece of like a length that would help you to stretch your arms up, put it under your feet and stretch it up.
Yes.
Small
Yes,
things.
some persons walk. My grandmother walks. She walks.
Back and forth.
Yes, and the more active you are, the better, right?
Very much so.
All right, so we'll go to a little break, and then when we come back, we'll wrap up talking to Dr. Ramsey from the Chronic Diseases Unit at the Ministry of Health about managing your diabetes.
Kaieteur Radio.
Covering Guyana from coast to coast.
Demerara and Essequibo 99.1 FM.
Berbice 99.5 FM. Kaieteur Radio.
Welcome back to Your Health Matters here on Kaieteur Radio. I'm Rihanna Ramsey, and we are wrapping up our session for today. We talked about managing your diabetes, or we're speaking about it still. Dr. Ramsey from the Chronic Diseases Unit from the Ministry of Health, at the Ministry of Health rather, is here with us in the studio, and she is giving us a whole rundown on what we can do to help manage that disease that can lead to death if we're not, and other complications if we're not careful. Dr. Ramsey, before we go, I know that you touched on a long list of ways that we can keep diabetes at bay, but could you just give us quickly back for those who are now joining us or would like to, and if you want to listen back to the program, you can go to our Facebook page and look for Your Health Matters and view what and listen to what we've been discussing here today. Also, Dr. Ramsey, can you just give us just a little bit of rundown of what we spoke about, just the tips quickly, and then you can talk about some of the ways where people can go to get help in terms of screening and stuff, and treatment management and that sort of thing, because I know that the general health centers offer services, and then you can touch on your awareness activities for November 14th.
So going back to what we can do, so little tips that you should do is that ensure that you always go to your appointments. Mm-hmm. All right. Ensure that you're always refilled on your medications. Mm-hmm. Ensure that you have you're eating properly. You're maintaining your weight. Mm-hmm. All right. Ensure that you care for your feet. Your feet are like the tool or the vehicle for you. Mm-hmm. And caring for your feet means checking your feet every day. Mm-hmm. Check to ensure that you don't have a corn, a blister, a fissure, and those are things that you will see cracks in your heels, like we say corns. You look for those tiny things on your feet. Moisturizing your foot, especially after finish bathing. Ensure that you pat dry your feet. Check between your toes, not seeing any fungus or any sort of rash. All right, those are, and please do not lotion between your webs of your toes. All right, that's the opening between your toes. Do not moisturize there. Just ensure that it's pat dry. All right. Ensure that your nails are clipped in the right way. It's straight and not in curves, because we want to prevent ingrowing toenails and calluses, meaning thickening of the skin around those nails. We don't want that. All right. Ensure that you have your eyes tested. If it's once a year, you get your eyes tested, to ensure that you're not suffering from any damages, especially leading to retinopathy.
Which is blindness.
Right, is blindness. All right? Ensure that your skin, like I said, is hydrated, it's moisturized. All right? And I would advocate that persons who are drinking or smoking, I would have cessation on those toxins, so that we can prevent ourselves from leading ourselves to becoming complicated.
No drinking, no smoking.
No drinking, no smoking. Where you can go to get your blood sugar or get yourself managed, it's one, to your health centers. In every village or every 2 villages, there's an area of a health center where clinic. Everyone can go. There's different days at different health centers where you can access care for chronic disease. Ensure that you call to ensure which day those centers are working, so that you can have your screening done, your checkups done. Whatever it is that you're concerned about of your health, just go to them and they would help you. Even though it's COVID, there is your protocols that you have to take into consideration. I still advise that you go to your health centers. If you have your family doctors, you are the persons that have to make this happen. You have to want to know about what's going on with your body. We cannot scan you by just looking at you. We have to take everything at different stages. Before I close and I say goodbye to this program, I want to say that on the 14th of November, That's Sunday at 11:30. We, the Ministry of Health Chronic Disease Unit, along with the Diabetic Association, is having an awareness that day, and we're going to have free HbA1c testing done, and that's a test, like I explained before, that's going to give you results within a 2 to 3 months period how your sugar levels were. And we would like to see that the public do address this area or show up to our event, and whatever question, whatever areas you would like to of your concern that you would like to be discussed, I will be there along with my other colleagues from my department, and there will be other persons from the rest of the areas that I've called Diabetic Foundation, where these are the youths who suffers from the type 1 diabetes, will be there to give you their stories, to help you how they have managed to work through type 1 diabetics. If you have a child or you know someone that's suffering with type 1, this is where you come so that you can learn about what's going on, what Ministry of Health is doing for you, especially the chronic disease unit, what we're there for.
And this is happening at the Ministry of Health?
No, this is happening on Cole Street, just opposite the Ministry of Foreign Affairs, or I would say where presidential offices on Brickdown, Cole Street.
Okay.
Right. So it's happening there. You're going to see the tents, you're going to see the ads, you're going to see the banners up, so you won't miss it. So please, I'm asking you to show up. I know we have our protocols where we're not asking that you come in lines, but we're trying to have our protocols still. I advise that persons living with diabetes or general public, we stick to our COVID-19 guidelines. Just ensure that you wash your hand, you wear your mask, and be safe out there. I want to thank Ms. Rihanna Ramsey again for having me on the program, along with her team from Kaieteur Radio. And I love that you could have reached out to me to be part of this. And I hope that whatever information we have shared here, it might be a lot, that some of it have been cleared up by our viewers. And whatever you have doubts with, probably just show up at Cole Street, and we can touch on base on that for you.
Yes. So that brings us to the end of the program. Thank you so much, Dr. Ramsey. For those who listened and tuned in via Facebook, we want to thank you for viewing our program and staying connected. Until we see you next Monday, stay safe and do take good care of yourselves.